Hair fall is one of the most common problems that I think we've all faced at some point in our life. Most often, how we address it is by changing our shampoo, going for some hair serums or conditioners, etc. And if we feel like these are not really working, we end up taking the big step of going to meet a dermatologist, which mostly end up in procedures and other treatments. But most often, we forget a lot of the small steps that are in between that probably play a much crucial role. In today's video, we are going to explore the real root causes of why you might be having hair fall with the help of Dr. Pranaya Bagde. She is our in-house psycho-dermatologist, and today we are going to understand what hair fall actually means and how you can maybe eradicate from the root. Hi Dr. Pranaya, it's so lovely to have you, and I think this is probably one topic that everyone is probably going to be interested in. I think majority of the clients who probably come into your clinic also have concerns of hair fall and wanting to fix it.
Hi, Gauri.
Hi.
Thanks for having me here. And as you said, it's indeed one of the commonest problem that patient comes to us, let it be male or female or even children. So yes, it is something that everybody should know. And this topic actually, because you practice functional approach, this is very, very important to understand how hair is a part of functional approach while dealing with different conditions. So I always tell my patients that hair is not just something that you see on the surface. Whatever affects it is all inside. So I think 80% of the reasons why you get hair issues are all inside your body. 20%, yes, in and around your environment and all those things will affect. So yes, I'm very glad to be here with you. Let's start.
Maybe the most probable causes or reasons of why people have hair fall. I think I've heard a lot of people say, my parents have had it, like my dad is bald, or my grandparents have had hair fall issues, and most often we tend to blame a lot of our hair fall issues on the genetics. So how relevant is that?
Yeah, it's quite relevant because we commonly see male pattern baldness, female pattern baldness, which otherwise in medical term we call androgenetic alopecia. So the name itself tells it is alopecia, means loss of hair. Androgenetic means androgen hormone playing a role, and genetic, definitely it runs in families. So it's quite evident that you get to see these patients often, and it's not just my father or my uncle. Maternal and paternal both will play a role. And like you said, if you consider a male patient who comes with a hairline recession or losing of the hair or thinning of the hair on diffusely on the scalp, then we always ask, did anybody in your family has? So how many generations of in family members you know? You don't know your whole family tree also. So I keep on asking not just your parents, your grandparents, your cousins, your maternal uncle, their children, everybody. So maybe one of them will have, or sometimes even they are three brothers. One of them will have hair loss issue, others are all okay. So definitely it matters what type of gene you carry, and not that every generation will express it. Sometimes phenotypically it's not seen, but they carry it, so maybe their next generation will show it. But as we know, we cannot actually know our whole generation. So we just say that okay, whatever I've seen after my grandparents, nobody had it, but there is always a reason. Even I see female patients, even post-menopausal or post-pregnancy, they always have hair issues, hair fall issues. So in that case, whenever I ask, did your mother had this? Did your aunt had this? So many a times they say yes. Even my Masi, that is my mother's sister, when she had menopause, she developed this thing. Okay, even my cousin sister or my elder sister, when she had a delivery, after that she had this type of issue. So yes, it goes as a genetics, and who will manifest that determined by a lot of factors, but you definitely carry the genetics if somebody in the family has it.
Okay, that's good to know. So you can understand whether you have a predisposition to it. But I think most people tend to see it as their fate. Okay, now my parents have it, now I will obviously have it. I think this is where it has a
To
lot.
this, I would like to add on that a lot of youngsters now come to me starting from 18 to 25 age. This is very early time. And they tell me my dad has baldness, but he developed it at the age of 50. Why I am getting it at the age of 20? So here I would like to tell, as you said, there is a genetic predisposition, but why you are getting at 20 when your father had it at 50? Here the environmental factors, your stressors, your day-to-day lifestyle, your diet, everything plays a role. So nowadays, early balding is very common. Definitely, it's because of the lifestyle that they have. So you cannot say that he had it at 50, so why I got it now. You have to take care of a lot of other parameters that are making your hair fall triggered. And also, you have to understand that though it is genetic, it's not something that you cannot take care of it. Maybe at the age of 55, 60, everybody loses a little bit of hair at a path of aging. Even if you don't have a genetics also, you lose. But when you know you have predisposition, there are a lot of things you can take care of beforehand.
Okay. So definitely genetics has a role to play in it. But just because your gene says it, it doesn't really determine how it goes for you. This is where your environment has a lot to play. So Dr. Pranaya, how does your environment play in your hair care?
Okay, so when you say environment, I can divide it into a lot of things. It's the environment that you live in, the place you are living. If you live in a seashore, you live in a mountain, you live in the countryside, it all matters because the type of food you get, the type of water you are drinking, and the type of water you are using to clean your body or hair. And other than that, environmental factor also includes the toxins that you come in contact with. Okay, so in what utensil you cook your food, that will determine what is getting inside, what type of food you are eating from the farms or grown somewhere locally, anything of that. So those environmental factors plays role. Even certain places they have component of heavy metals, so that gives toxicity. So those type of environmental exposure also will give rise to hair issues. And a lot of research have shown that certain locality have sometimes arsenic more or mercury more, or some type of people who consume food in a particular utensil like aluminium or now ceramic or non-stick. They have particular type of chemical that your food is cooked in. So you can even see traces of those chemicals or toxin in your hair shaft when you examine it. So our environment definitely affects a lot of things. And when I say the physical environment of water and other things, hard water where the salinity is very high, that affects your hair. Previously, it used to be like it's a myth and it doesn't affect it at all. But no, the salinity of water, the hard water from the well or those who live on the seashore, those areas, the salinity of water is very high and that is little bit harmful for the hair. And you get breakage of the shaft. Your scalp will not be cleansed properly. Definitely from the root, then the hairs are getting broken off, and you get more tendency for dandruff, and your scalp hygiene cannot be maintained. So definitely environmental factors are very, very, very important. Also, people who are into media industry, so those who always have to treat their hair chemically. Again, lot of chemical exposure. For them, it's their job and they have to do it. Like you are doing the parlor procedures, spa, keratin, pumping, curling, straightening, ironing. All these things are going to damage your hair. So take my word that once you treat your hair chemically, it's permanently damaged. You cannot go back to your original hair texture or hair color. So those who do it, definitely they are causing harm to the hair. So this also comes as a chemical exposure as a part of environment they live and survive. And even hair color. People they say I'm using it since so long. How is it going to give me hair fall? There are a lot of research work and studies available that people who use hair color like every month for their whole life, they definitely get some or the other hair issues. Thinning, diffuse thinning of the scalp is quite common with that. So you'll ask me, this is an era that everybody uses all this. How can we prevent? So you have to understand what type of hair you have, what's your texture, what type of things are suitable for your environment and for your body, and accordingly you need to use. It's not that everybody can do everything. So yeah.
Correct.
So understanding those things is very, very important.
we have a lot of clients coming in who also, they don't come in with the complaint of hair fall, they come in with probably thyroid dysfunctions or PCOS, and even in all of these conditions we see that hair fall comes as a byproduct or a symptom of it. So how is that related?
It's a very good question because many people they say my periods are regular. I just have hair fall, and why you are telling me PCOD? Or else thyroid I am having since so many years. I am on medication, it's under control. Then why are
Values
you
are
telling?
same.
Yeah, why are you telling that this hair fall is because of that? So there are two things I would like to address here. The first important thing is thyroid disorder is an autoimmune condition, right? So when you get diagnosed with any thyroid disease, let it be hyperthyroidism, Graves' disease, goiter, or hypothyroidism, you have to understand that your thyroid function is affected, and that has an effect on your body because thyroid is such a hormone which affects from hair to toe everything. Every system of your body is affected when there is thyroid function abnormality. So when you get diagnosed with that, already it has started affecting your skin and hair. The visibility of symptoms may be sooner or later. Right. So sometimes patients come to me and they say, I have hair fall, and I give them battery of investigations. In that, thyroid is very important. And they will be like, TSH is quite high. They're like, I don't have any symptom. I didn't put on weight. I don't have anything. I just have a hair fall. So see, it can be reversed as well. So the hair fall could be one of the manifestation of the thyroid disorder.
I think most people don't really connect like that. There are clients who come in who say, I have hair fall, give me some supplements. And I ask them, or we do the assessment and we ask them, have you gotten your thyroid levels checked? And they're like, why? So, most often people don't really connect all of these symptoms to their thyroid functions or other hormone functions also.
Yeah. Even for that sake, people who are planning pregnancy, they are on some infertility medications, they are taking hormones. Even young girls who have high prolactin, sometimes their periods are delayed or irregular, they are put on some hormonal pills. Or any type of hormonal change that happens in the body, it has a lot of influence on the hair. So as a hair structure, it is called as pilosebaceous unit, right? So there is a hair, there is sebaceous gland, there is skin structure, glands, everything is there, blood vessels, nerves. And when the hormones are changing into the body, any hormone for that sake, we are talking about thyroid. So if suppose thyroid dysfunction has happened, there are receptors on the hair. Okay, so it goes and the signal goes there that something isn't going well with thyroid, and this is what is happening. So your hair cycle changes. You start thinning of the hair first. Okay, you start feeling the volume has reduced. Before my hair used to be this much thick when I used to put a ponytail, and now it has become just half. Then slowly you start certain areas of your scalp are having thinning. Then you start getting visible hair loss that everywhere you will find the hair. Okay. So in that case, evaluating the thyroid function, understanding how is your hair fall connected is very important because there slowly, your hair goes into falling stage higher than the growth stage. Normally, let me tell you, we have a hair cycle wherein anagen means growth phase, catagen is resting, and then the falling phase we call telogen. Okay. So at one point of time, when there is this thyroid dysfunction or any metabolic dysfunction, the anagen phase, that is a growth phase, gets arrested. Means there is no stimulus for growth because somewhere something is going wrong. So what will happen? When 80% of your hair cycle hairs were growing, they are arrested. And the falling has increased from 20%. If that goes to 50, then you'll see only hair fall. Right? So these changes happens very micro level inside the body, which are evident later on in life. Okay, maybe after 2 years or 3 years, so both can happen. Your hair fall can be one of the manifestation of thyroid, or after getting thyroid, when everything seems okay, it's controlled, still you can have hair fall. And then you ask me about PCOD. So for your consultations, maybe they come up with a lot of gut issues and hormonal issues and pigmentation. What I see very commonly is acne.
Yeah.
patient comes to me with bunch of dysfunctions, like they will have acne, they will have unwanted hair on the face, they will have some pigmentation, sudden weight gain, and definitely frontal hair loss. This area, they will have hair loss. So when that happens, and I'll be like, I think this is not just on the surface, you have something related to hormone. So most of them will give history of some irregularities of menstrual cycle, or some change in the flow of the blood, or they will have clots more, or even they will have lots of cramps when they get menstruation. So any of these symptoms will be there. And I just ask them simply, can we just get your ultrasound done? Ultrasound pelvis, get it done and see if you have any problem with your ovaries or uterus. And 90% of the time, I get some or the other issue over there. Okay, maybe on a gynecology point of view, it's not significant. So they will tell, this is all fine, just control your diet and exercise, it will be okay. But as a functional medicine practitioner, I understand when your skin is showing that symptom, when you are having some changes on your ultrasound, it tells to me your body is reacting to something that is not going normal, isn't it? So PCOD and hair fall, it's very well connected. Again, PCOD has a lot of connection with thyroid. It has connection with insulin. It has connection with cortisol. It has connection with your androgen hormone. So there are multiple things connected. And ultimately, the patient lands up into diet, exercise, which they never follow properly, and their issues keep on growing. And when they come to us, it's the first thing that we have to know. If you're just taking care of the hair by taking vitamins, it's not going to help you. So you have to fix the overall thing together. So PCOD and thyroid, as you said, they are very, very, very relevant topic in hair fall, which people always ignore. They think, how come my menstrual cycle going to give me hair fall? But it's all connected, because again, there also the hair cycle changes because of the influence of the hormones. Your hair goes into thinning, thinning, thinning. That's what we call miniaturization. And ultimately, then you get a patchy hair loss. So these are all the things that's very important. And how longer is the duration of your symptom? That will also decide the severity of your hair fall.
Okay. But I think as an individual who's suffering with hair loss, you should have a very clear idea about your hormone status and your overall hormone health. That is very crucial to being able to solve it from the root.
Yeah, and nowadays it's like, we live in the digital media. So every time somebody tells, oh, use this, use that, use this serum, use that serum, and it will be all gone. It cannot work like that. It's a very customized approach when we treat hair fall. We cannot generalize that this serum is good, you just apply. We cannot generalize anybody's internal issues, right? See, somebody is having stress, somebody cannot sleep well, or any of those factors. Somebody is eating some food, somebody not eating some food, nutritional deficiencies. And those, how can a serum be given for that condition? Unless and until that is not being sought completely, properly evaluated well, you cannot treat that hair fall. And that's why a lot of people fall into wasting their money and time in using the products.
Correct. Having a very clear understanding of your overall hormone health, which indicates your thyroid functions, if you're somebody who's menstruating, your overall estrogen and progesterone cycle, being able to understand if you have a healthy, regular and scientific menstrual health, being able to understand your overall cortisol performance, your overall insulin performance is also very important if you're actually trying to get rid of hair fall from its root. Moving on, doctor, I think we have had a lot of clients who also complain about hair fall, and these are women who are in their perimenopausal or postmenopausal stage. Now, how is that connected?
Yes. So that's quite common and physiological condition, I would say, because a woman goes through a lot of phases in their life, like menarche, then pregnancy, then menopause. So three of these phases will have impact on the hair, right? In the menarche, we always get extra hair growth, so it becomes thicker, darker, and we start getting, the good volume of hair. Pregnancy is variable again, because there is immunity change, your physiology, body functions are changing, organs are changing. So many of the women who conceive after that, their hair improves.
Yeah.
Again, supplementation is there, everything is there, and post pregnancy they lose hair. Again, the hormone plays a very important role because sudden withdrawal, right? Till now your progesterone was high, you were carrying, now baby is delivered, there are a lot of changes happening, you are lactating, your nutrition, if it's not good, it will affect the hair cycle. Next, the important question that you asked is perimenopausal age. So now we also have a wide range of age when we can call it as a perimenopausal, starting from 40 up to 60. There are people who even have menopause at the age of 58 and 60 also. It depends. That's again genetic, as we discussed already. So when 40 plus female comes and says that I have started losing hair, or I feel that my hair thickness has reduced, it's because in the perimenopausal age, they always have withdrawal of the hormone estrogen. Right. So your body will not have estrogen anymore. That is a preparation of the body. Right. And as I told, there are hormonal receptors on the scalp, on the hair. And when you don't have a particular hormone, what is going to happen? The stimulus to grow is not there. And it's not just the hair. There are a lot of things changes in the body as well, right? Your bone health will, your bones become, osteoporosis is common. Your bones become weak. You get backache, you get hot flushes, you always get a little high blood pressure. There are a lot of things that is changes metabolically and physiologically in the body. So hair cycle also in that time under the influence of this lack of hormone during menopausal time, anagen, that is the phase of growth, gets arrested completely and you always get the thinning. But here again, because the hormones are playing role, more than the hair cycle, it's a miniaturization because the hair becomes thinner, 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 and at one point of time, it's not seen. That's what we call female pattern baldness. So from the hairline partition, central area, they start losing the hair, it gets widen, 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 and ultimately you get a patchy area over there. Maybe the back of the scalp, the back occipital area, they will have good volume, good strength and everything, but the frontal scalp, they lose hair. So there are patterns of losing hair. So this type of pattern we call female pattern androgenetic alopecia or female pattern baldness. So it's quite disturbing to women, those who are in that age. But if they can understand early and take medication and treat it properly, definitely they can reduce their hair fall and they can maintain a good volume of hair also.
What are the other probable causes of hair fall? Other than all of the things that you've mentioned now, because I've heard, I think as part of the whole treatment and process that you were saying, we have a habit of pulling our hair, tying it really tight behind. Are those all really causes for hair fall?
Yeah, localized alopecia, you can say. So, especially the school going kids, their mother, they tie their hair quite tight so that, it doesn't get bushy and it can be maintained. So, that time, the frontal scalp here, then it is being tied very, pulling it back. From here, they get a triangular alopecia. So, from that area, the hair gets thinner, thinner, and you feel that the frontal line has gone little back. We call it triangular alopecia. And the only treatment for that will be, make your hairstyle change or don't pull it that strong or make it a little loose. And when you talk about pulling, I would like to mention here, there is a condition called trichotillomania. When it says mania, definitely it has a relation with mental health. Trichotillomania means hair pulling disorder.
Okay.
Okay. Now I was telling that the mothers are pulling their hair and tying it tight. But here, the person itself pulling the hair, it's an impulse control disorder, trichotillomania. The person or the child, he or she himself pulling the hair to relieve their stress.
It's a stress response.
Stress response. So they cannot control that impulse to pull the hair. So small kids, like maybe after 6 to 12 years, that range, mothers will tell, he is sitting in the bathroom all the time. And whenever he is studying also, his hand is like this and he is rolling his hair. Okay. Because when they come to us, they will not tell this habit. When we examine, when we get to know from the accessible areas like here, 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 which are all the accessible areas easily pluckable, they keep touching that area and pull the hair out. Okay. So hair pulling disorder again is quite common in children. When there is an exam, when they don't like a teacher, when they are scolded, or there is disharmony in the family, when there is a sibling rivalry, any of those stressors, to respond to those stressors. See, in childhood, it's really very difficult to understand if your child is depressed. You always feel he just shows the tantrum. But the underlying depression sometimes can be manifested like trichotillomania. Okay. And as a practical treatment, I tell parents, if possible, just shave off the scalp completely. What it will do? There is no hair to pull. And we always have a treatment like, habit reversal. So if there is no hair, for the hair to come to a length when it can be pulled, it will take some time. And by then, this habit of pulling the hair will vanish. Okay, so if you miss some points of this hair pulling or how people are doing the styling on the scalp and everything, even the alopecia reasons are different. So that's why if the reasons are not being found, you cannot treat it well. Even if they are taking a lot of supplementations, applying lotions, I see patient coming to me like 5 and 6 years, they are just using lotion. And then just I ask, do you have this habit? Have you noticed any time? Then they say, yes, ma'am. Whenever I'm stressed, I just feel like, I just do it automatically. It's not decided or intentionally. I said, that is why you're getting this hair fall. So unless and until you get rid of this habit, how are you going to get your hair back? So hair pulling is also it's a mechanical trauma to the hair, right? So that is one thing. And when you ask me, a lot of other factors are also there that plays role in case of alopecia or hair fall issues. Certain drugs also can cause hair fall. And very commonly, we all know then chemotherapy drugs. Whenever somebody gets diagnosed with cancer, when they put on chemotherapy or radiotherapy, they lose hair. So because of the sudden change in the body physiology, also the chemical medication, whatever the body is receiving or the radiotherapy body is receiving, in reaction to that, you get the alopecia. But that's reversible. Once your chemotherapy are done, once you get back to health and when your body is responding well, your immunity is developed, you get those hairs back. So that is one condition where the drug plays role. Also, many of the times, people who take oral contraceptive pills, they also tend to lose hair. Those who are on chronic medication, like for heart disease, for neurological conditions, for diabetes, even for thyroid, there are different types of thyroid. So hyperthyroid medication, or even if you have mood stabilizers, some type of psychiatric drugs, as a side effect, they lose hair. So whenever you are taking medication on regular basis for a long period of time, like more than 10 years, you are keep taking the medications regularly, you can have hair fall. So we always ask the patient, are you on any regular medication? They're like, no, I don't have any disease. I'm all well. I'm not having any problem. But then something they will tell, I'm taking this supplement which has this content. Right? So some extracts or some type of metal or heavy metal as such, if that component is there in that medicine, it will definitely affect your hair. So we always have to inquire about what all things they are consuming on day-to-day habit. Let it be a supplement, let it be a drink in a sachet or a nutritional value-added some things, fortified things, everything of that we have to see because they are all can affect the hair health.
Doctor, one very important question that I want to ask is now people are going crazy over biotin supplements. I think most of the clients who come to us with hair fall, they've watched videos on Instagram and they themselves tell us, can I start with biotin? And they think biotin is some magic nutrient that will solve all of their problems. And these are also people who might be eating so much refined grains, processed food, junk foods, but they think a biotin supplement is going to solve. So, nutrition wise, what are the areas to observe or keep in mind in terms of hair fall?
Yeah. So even nutritional deficiencies are the commonest cause of hair fall, the commonest. So whenever somebody complains of having hair fall, that's the reason that even your pharmacist or chemist will give you, oh, take this supplement and it will be all right. Because that's the commonest condition which gives rise to hair fall. So protein energy malnutrition, you might be knowing in children. They also get very bad hair issues. The color will change, texture will change. So definitely protein is one of the common deficiency that gives rise to hair fall. The next very common
Protein.
protein, yes. If there is lack of good protein, you lose hair. Okay. The next, very importantly, after puberty, in female especially, iron deficiency. Okay. When the menstruation start, if they're not consuming enough iron because they are losing blood every month in menstrual cycle, iron deficiency is the commonest cause of hair fall. Okay. Then you have different minerals or trace elements like zinc, calcium, magnesium, selenium. All this deficiency, micronutrient deficiencies can also give rise to hair fall. And certain vitamins like vitamin D and vitamin B12. These are the two important vitamins that can give rise to hair fall. So in nutshell, if I have to say, protein, iron, vitamins, and minerals. These things you need in a optimum level for the hair health. So any of it, sometimes we just don't have iron deficiency. We'll have some other nutritional deficiency as well. Like people who get vitamin D deficiency, they will always have calcium low, their potassium, all other magnesium, everything will be low. So multi-nutritional deficiency is one of the condition. Here, when you spoke about biotin, I would like to explain that biotin is a type of vitamin. We call it vitamin H. Okay, it's a type of vitamin which our gut is synthesizing itself.
Okay.
We have an enzyme called biotinase, which is there in the gut flora, means the intestinal wall. So, whenever certain products we are consuming, which has biotin, this enzyme is there, which is actually secreting enough molecules to digest and provide the biotin required for the daily allowance. So usually we never get deficiency of biotin.
Okay.
Okay, and that is why we never check serum biotin test to see the levels of biotin. Then why people give so much of biotin? Because biotin is water soluble definitely, so there is nothing specific instructions to be given to take it, and it's an extra support.
Okay.
It's not because of the deficiency that we are giving biotin. We are giving it for the extra support for the better generation and cellular maintenance of the hair and nails and skin. So it is not just not for hair, it's for the skin and nail. Brittle nails, they give biotin, or skin texture, if it is very dry, not improving, you feel all the time glow has lost and all that, biotin helps. But it's not a deficiency. So whenever somebody gets a hair fall, I won't straight away go and tell them take biotin. Not advisable. First, go for the basic things that your hair needs. And then biotin is always an add-on. It's an adjuvant. So we never get biotin deficiency. Even if somebody doesn't take biotin and take the other nutrients, their hair fall will stop. It's not a mandatory thing. Okay. And previously biotin was available as 5 milligram, 10 milligram. Now FDA has reduced the daily allowance of biotin to 35 microgram.
Okay.
So see, even we don't need 5 milligram per day. So biotin is not necessary for the body on day-to-day basis because we generate it in our gut. But yes, addition of it is going to give you an extra support. That's why biotin should be taken. But focus on the protein, iron, minerals, vitamins. These are the very important nutritional support for the hair growth.
Okay. And I think since you mentioned gut here, and I think it's very important to also highlight your gut health and your skin health and thereby your hair health.
Yeah, they are all like, I practice psycho-dermatology. So as skin and mind connected, gut is also connected to skin. So it is skin, gut, and mind. They all go hand in hand together. Anything that affects any of this system will affect skin also. It will affect gut also. And neurologically, definitely there are a lot of changes. We all know that. So yes, when gut issues are there, malabsorption issues there, your nutrients are not getting absorbed. It will affect your skin health. When gut issues for which you are taking chronic medication,
Yeah,
your
correct.
gut flora changes, right? Continuous acidity, acid peptic disease, or irritable bowel disease. You are under stress all the time, so you get those symptoms. So see, everything is connected. So yes, gut dysfunction, even stress, neurological issues will also give you hair fall, or any skin conditions will get aggravated after you experience such issues.
Okay.
I think a lot of people also struggle with dandruff, and this also ends up causing a lot of hair fall. Let's try and understand that better. Doctor, dandruff and hair fall, how is that connected? Or is it connected?
Yes, a little portion of people they have hair fall associated with dandruff. So here, dandruff means a condition wherein you get a lot of flakiness on the scalp. Okay, so that's again a layman term. In dermatological word, we call it seborrheic dermatitis. So people who always have sweating, okay, they get a lot of dandruff. Who are not washing their scalp well, they get dandruff. And invariably, sometimes they also fall into getting pimples on the scalp. They get greasiness on the scalp. And all these conditions, what it means that your scalp hygiene is not maintained. And how a plant will grow when the soil isn't good, isn't it? So when your scalp isn't good, your hair cannot stay there. And then from the root, the hair gets broken off. Okay, so it's not actually a hair fall. It is because of poor scalp hygiene or increased flaking or pimples or greasiness, the hair shaft gets broken off and you see the visible hair fall. But that is very common, treatable condition. Within weeks or months, you can just get rid of it. If you use the correct shampoos, take medications, and keep a proper hygiene on the scalp. So dandruff or pimples on the scalp or greasy scalp giving hair fall is quite common, but it's something which we can immediately take care and address it quite maybe around 1 to 3 months time itself. You can get rid of the hair fall issue. That's very, very common actually.
I think from this, it's very clear that hair loss is not a problem that exists independently. It is extremely connected to who you are as a person, your genetics, your growing up, your childhood, your environmental factors, like she was mentioning, the water, the food that you use, the utensils that you use, the water that you shower in, the water that you drink. There are other factors of your overall hormone health, your metabolic health, your diet plays a crucial role, your gut health plays a crucial role. And without me having to say it, I think it's very clear that your stress and your sleep and your routines and your activity, everything basically plays a role in your hair fall. So being able to look at your symptom as a message trying to tell you that something else is going wrong in your body is very crucial to addressing it. Now, this is called a functional approach to health. I think, Dr. Pranaya, you might be having a lot of clients coming in just to address their hair loss. But when you start interacting with them, so many clients, we've sat with them for hours and trying to understand, it makes it very clear that hair loss is just a side effect of their poor sleep, of the stress that they're going through in their job, or their very poor dietary habits that they've been following. Or it can even be from a chronically gut dysbiosis that they've been carrying around for years. So,
Yes.
how should a person be able to look at hair fall from a functional perspective?
Yes. So this is not a new thing, but a lot of the conventional dermatologists, I would say, they will not consider hair fall as a internal issue. I tell my patients, being a trichologist or a dermatologist, I am going to give a support system for your hair to sustain, to look good, to get strength and the hair fall to reduce. Growth takes longer time, right? So when, as a functional approach, we have to look for their day-to-day habits, their lifestyle, their eating, their emotions, their family harmony, their genetics. So you see, none of it we can cure by giving medicine.
And none of it happens over a day also. It takes.
Exactly. So I always tell them, in your hair fall, my role is only 10 to 20%. 80%, you have to take charge of your hair health now. That if I have vitamin D deficiency, what I'm supposed to eat. If I have sleep disorder, how I'm supposed to going to manage my sleep hygiene, or how I'm going to eat so that I can get good sleep, how my alcohol intake or my smoking affecting my hair health, how I'm going to correct that, how I'm going to be in a good thought process and good mood, and how I'm entertaining myself by my hobbies. Everything of it is dependent on their own decision. Okay, whatever I inject, whatever I push in the scalp, whatever I ask them to apply, whatever pills I tell them to take, it has a limitation. So I would say 80% of hair fall or hair loss issues are internal problems. So it's not that I'm going to send them to psychiatry directly if they say I have stress, or send them directly to gastroenterologist if they say I have a gut issue and malabsorption. Definitely, if needed, and depending on the severity, we have to take opinion. But we have to make them aware that this is a way you are going to improve on your health, and invariably your hair will improve. Okay. And it's not something that will happen overnight. So for your hair to get a good stimulus, till now your hair is under a stressful time, so it's falling. So the good stimulus is not there. When you are adapting a good lifestyle, sleeping well, eating well, being happy, and removing all the unnecessary triggers in your life that is contributing to the hair fall, your hair starts getting good stimulus. It will start growing. But when will it be visible? It takes time. So ideally, when the treatment starts, along with the supportive treatment, evaluation and addressing that particular cause of the hair fall, it takes almost minimum 3 to 6 months. And for the hair regrowth, it may take another 6 months in addition. So it's not just that simple. And we always need a lot of cooperation from the patient, because if they're not taking care of these small things, it's very hard to treat. Like in functional medicine, we always focus on your gut health, your emotional health, your lifestyle routine, your physical activity. All these things matters a lot. Even if
Correct.
I'm giving nutrition, like I'm giving iron supplement, but if they are taking iron along with the tea, how is it going to absorb? If I am giving them vitamin D supplement, but they are not eating good fat rich food, how is it going to get absorbed? Right? There are a lot of those things that the person has to understand, that just taking a pill is not a solution.
I think it's very important that the individual himself or herself is educated, and that is where it starts from. But like we discussed, we've been talking for the last so many minutes, and it's very clear that there's a lot of science that goes behind why it's happening to you and why it's happening to you at this point. I think that investigation or that comprehensive exploration that we do is probably the most crucial element of functional medicine itself. And I really like the point that you said about how only 20 or less than 10 percentage is in my hands. The rest of it is something that you have to figure out, you understand, and you correct it, and something that takes time.
Yeah. But conventionally, people say, oh, you take 4 sessions of PRP, you just go and take the meso, you take this stem cell, this thing. But that is not the way. Yes, definitely you can take. That will support, that will give you a temporary relief. But that is not how the disease can be controlled or cured. So in that case, I always tell my patients, even if you go for it, but if your sleep is not corrected, you are wasting your money and time, right?
Correct.
If you're not taking care of your food habits, your work stress is always the same. Sometimes people do overtime so much, they are physically strained. They have no time to think about themselves.
And then they think a biotin supplement is going to solve all.
Exactly. It's not going to. If you're going through a bad work life, if you're going through a bad marriage, it's obviously affecting your health.
Correct.
And I have seen people, they come to me for hair fall. I get them, help from a psychologist or a psychiatrist for counseling. because they're actually having some issues that are, the conflict inside, which were never resolved, and they still live with that at the back of the mind and keeps getting stressed all the time. So it's a, I would say, hair fall is just a umbrella sort of thing. There are a lot of things inside, and for every individual, the things may differ. They can
Correct.
come in combination or individual, but the things are different, and addressing that individual thing that matters. So if somebody tells you that take 4 sessions of PRP, do hair transplant, this is it. No, it's not permanent. Even hair transplant isn't permanent.
Mm.
Okay. So hair transplant for a particular person, whenever you do also, definitely you get your look back, but you have to maintain. How are you going to maintain it? It's not
Yes.
just putting minoxidil and popping the finasteride tablet, right? Because it also has an influence that is coming from your own body, your gut, your emotions, your day-to-day lifestyle. So even if you go for high-end state-of-art technology and medications and treatment, you have to understand your body will get all the stimulus, your hair will get all the stimulus that you're providing. So those things has to be corrected like we do it in functional medicine. So hair fall is definitely one condition where just not look on the surface, but look inside and get things sorted and evaluated. Unless and until it is being done, the patient will be just a doctor shopper. He will running from one clinic to other, spending a lot of money and time, and ultimately he'll be like, oh my God, my hairs are still not growing. That happens. So, and means outside world will always project this is the best treatment, this is this thing, this is that thing. It's a general way of telling people that this is a molecule that is available. I cannot say this is helpful for me or this is helpful for you unless and until we try it and we understand what is your body, what is your physiology, what is your tolerance level. So marketing and digital media and social media telling you a lot of things is another aspect. But understanding your own things and then addressing your issue, that is a very, very important thing.
I think, Dr. Pranaya, this gives everyone who's listening so much clarity on understanding that their hair fall is not just a random hair fall. It could be indicative of something going wrong in their body. And I really hope this video helps people actually look inside and understand the actual root causes and trying not to look for immediate unscientific mechanisms to fix it. So thank you so much, doctor, for this very comprehensive understanding of our human body and hair and all of that.
Thanks to you, Gauri. Thank you very much.
The first step to understanding or solving hair fall is trying to understand where is rooting from. Like we discussed today, it can be a multifactorial problem and it can affect different people in entirely different ways. So, a reason a person has hair fall might not be the exact reason another person has it. So, the same solution might not really work. So, instead of looking for quick fixes, instead of looking for something that doesn't really address the actual problem, try to look for long term scientific problems that can actually address why you have hair fall. Like discussed today, it can root from an array of problems in your lifestyle, and in fact, working there is probably much, much simpler than going for invasive procedures and treatments and scalp applications. So, hope this video gives you a very clear understanding of how you can look inside and try and figure out what could be the potential triggers or root causes, and not just see hair fall as a external problem.